I think what we see is that increasingly health is seen as a strategic policy area in which all the actors in a conflict try to manipulate and to use health as an element of combat instead of what has been foreseen by the Geneva Convention to see it as a space of neutrality and impartiality.
The attacks against health workers, against patient hospital, is one of the major humanitarian challenge nowadays that is largely underreported. This is affecting the life and the health of millions of people, and we believe this issue has to be put on the table, discussed with the public, discussed with health professionals, and also discussed at the policy level with stakeholders at state level, so that the appropriate measures are taken in order to ensure that there is a safe and proper delivery of healthcare in the future without deliberate attacks on health practitioners.
Unfortunately, it's also a reality for us, not only in the field of humanitarian field, but also here in Geneva. We have some acts of violence on our own staff, and I think the main challenge is not to be led by fear, but to be led by professional responses, so that we can not only accept not the unacceptable, but accept that we live in a dangerous environment sometimes, and to provide professional responses for professionals. And there, I think we have to learn one another. Of course, it's not extreme situation like they live as humanitarian organization, but still, there are some quite, I would say, new paradigm with the violence that some people do to our staff that we have to take in consideration, be it at the end of the world or here in Geneva.
What we realize in conflict zones is that increasingly the health system is disintegrating, so public health and public health services can't be provided to the population. Increasingly transmissible and non-transmissible diseases spread because of conflict and because of the disintegration of health structures. So it's important areas in which public health, global public health, can't be provided, and therefore as conflict spread, also the holes in the global public health system get bigger and bigger.